of inhaled corticosteroids, montelukast. I think the biggest side effect that people are reporting is growth, so long-standing uncontrolled asthma, in any case, delays achievement in final adult height. And children treated with inhaled corticosteroids for several years have been found to attain normal height. There is, however, one randomized controlled trial, children 5 years on 5 years of treatment of budesonide 400 micrograms a day, which did report about a 1.2 centimeter reduction in adult height, which was detectable, particularly in children who started their treatment before the age of 10 years. So, I mean, that's a reality. We do have the concern about a reduction in final adult height when patients are treated with inhaled corticosteroids. There's really no increased risk for bones and fractures, osteoporosis, but please be aware of corticosteroid overuse that has been associated with about a third of patients that have got or that received only 4 lifetime courses of corticosteroids. So this is definitely something that we should try and avoid. Then the 2020 March, in 2020 March, March 2020, there was an FDA black box warning that was issued, and this basically just warned against suicidal attempts by using montelukast in adults and adolescents. Some children were also reported to have nightmares and behavioral issues. So it's quite important that patients should be counseled when it comes to montelukast usage, and they should be told how to use this. So what else is new in 2020? And then I'm basically finished. So basically GINA 2020 had an interim guidance publication on how to manage acute asthma or the asthma in COVID pandemic. So advised patients to continue their use of the inhaled corticosteroids. So now is a good time to be excellent or to have an excellent adherence strategy. All patients should have a written asthma action plan. Where possible, or avoid the use of nebulizers and instead use multi-dosing technique. I'll talk about it in a minute. And then postpone spirometry and peak flow meter and really use it when it's necessary, because we know these are aerosol generating procedures, which is not a good idea in the current COVID-19 pandemic. And this is actually hot off the press. So it's a group from the World Allergy Organization, from the World Allergy Journal that was published recently. And they basically give guidance on how to treat severe asthma management in the current COVID-19 pandemic era. So that block on the right, so multi-dosing instead of running to nebulization, they actually suggest we use multi-dosing with a salbutamol meter dose inhaler with a spacer, either with a mask or a mouthpiece. Repeat your multi-dosing technique 3 times in the first hour, so that's basically every 20 minutes, and all ages should receive 10 puffs at a time, administer 1 puff at a time, and then 1 puff should then equal to allowing for 6 breaths per puff. So multi-dosing is actually being focused on instead of nebulizing to prevent aerosol generating procedures. Then the general severe asthma management also focus on fairly early administration of systemic drugs and relying on their bronchodilation instead of using inhaled short-acting beta-2 agonist or inhaled nebulized bronchodilators. And then you can see the single-dose intravenous magnesium sulfate has now been recommended in fairly early in the treatment. And then the life-threatening remains the same. Good nebulization with your short-acting beta-2 agonists. If they're not getting better, then intravenous salbutamol is actually advised. All right, so there's just a few references. There's excellent reports on the GINA asthma strategy or the Global Initiative for Asthma Strategy, and that 3 or 4 publications is on the South African Asthma Working Group, which is, as far as I understand, about to be there's new updated guidelines, and feel free to ask questions.